Welcome to WYCE's Community Close-Up, our weekly public affairs program produced in partnership with the Rapidian, a hyperlocal news service of the Grand Rapids Community Media Center. Community Close-Up brings you a diverse perspective from community leaders throughout West Michigan. I'm WYCE's Janet Zahn, and it's my pleasure to welcome our program this week, Veronica Horsley-Pettigrew, Community Outreach and Marketing Supervisor with Care Resources PACE. Welcome.
Well, thank you for having me here.
That's right. Online, they can be found at careresources.org. And just a little bit to introduce you to Care Resources. It's a program of all-inclusive care for the elderly. Program All-Inclusive Care Elderly. That's where PACE comes from. PACE is a Medicare and Medicaid-funded option that gives community-based care and services to people 55 years or older, helping to prevent nursing home placement. PACE provides coverage for prescription drugs, doctor visits, transportation, home care checkups, hospital visits, and nursing home stays when necessary. Welcome, Veronica, and I would love for you to tell us just a bit more about the great work that PACE does. It's a well-kept secret, and you're here to help reveal a bit about the secret.
Yes, I am. PACE, the program, has been around for over 50 years.
Wow.
And there are about 190 PACE programs in 33 states. And in Michigan, there are 14 PACE programs, soon to be 15.
Mm-hmm.
And it is still the best kept secret. It is an amazing program. And I could tell you that all day. And I've seen how this program has changed people's lives. And PACE is, it stands for Program of All-Inclusive Care for the Elderly 55 and older. We don't make the rules. Some people say 55. Are you kidding me? I am a senior at 55. We don't make the rules, but I get it. But we do have people in our program who are 55. You know, not everyone ages the same. Aging is an individual, personal journey. Mm-hmm. But PACE is here to help on that journey. PACE is a model of care, all-inclusive. And what that means is that we take care of the person's body and mind. The mind for a peace of mind that you are being cared for, and your body to make sure that you get all the services that is needed to keep you safely in your home.
That's so important to many people, Veronica, to be able to stay in their home as long as possible. That independence that you're helping to support is vital to the peace of mind, not just of them, but probably of their families too.
Absolutely. And what is, I think sometimes people say it's too good to be true, is that normally, I mean, we were taught that when you aged and you went to a nursing home, there was nothing in between.
Right.
So 100% of the people that are in our program are nursing home eligible, but they're not in a nursing home because we have supportive services to keep them in their homes. So what that looks like is that it depends on where you are in your aging journey. Mm-hmm. Well, it could be some memory concerns, not necessarily that you have dementia, but you can't remember to take your medication, to schedule your appointments. Mm-hmm. And that is very important to be compliant with medication and your doctor's appointments for optimum health.
Sure.
And so if you're not remembering to do those things, then you're not staying healthy. And then sometimes people have to go to a nursing home.
Right.
So with PACE, part of our all-inclusiveness and taking care of your body is that we have our own clinic with our own primary care physicians. They only work for Care Resources PACE. We have nurses. We have a rehab gym. If you don't use it, you lose it. And that is very important to exercise your body. And we have social workers who advocate for the person that's in the program. And if they're living with their loved one, a family members, a whole family, maybe their son and daughter-in-law, and they have grandchildren, then we're advocating for the family as well.
Right.
And transportation, huge. One of the first things probably that seniors lose the ability to drive. And that is very heartbreaking. I saw that my grandfather go through that. And not, he went to the store one day and he couldn't remember how to get home. So they took the car keys.
Yeah.
That's very frustrating. What happens is when you lose your ability to drive, it narrows your scope of interactions.
Yep. And but the thing is, it's like if you're really not capable, we don't want people driving that really shouldn't be driving.
Absolutely.
So what you're doing is you're helping to maintain that broader vision of what life is, bigger experience by helping to get them where they need to go, especially with regard to their healthcare needs.
Exactly. And not only that, as far as the mind, we have a day center and 2 locations, one in Lowell and Grand Rapids is where I have 2 buildings. The day center provides socialization.
Okay.
And socialization is key to your health, your mental health and your physical health. Feeling connected to your peers. We all need to have time with our peers.
Yeah.
And when you come to the day center, you get 2 snacks and a lunch, and you play games. Bingo is huge. Who doesn't love bingo and winning prizes?
You can win. Everyone wants to win.
Everyone wants to win. I don't care what. If it's a PID, you want it, and that adds to the fun of the socialization. And
sure.
And if you're coming one day a week or 3 days a week, you're seeing your friends and you're building relationships. It's like all of us. We like to get with our peers and laugh and talk and have a really good time. That's part of optimum health. You are helping your mind and your body to stay healthy.
So is the center open sort of like your basic Monday to Friday,
yes.
9 to 5 kind of thing?
It's Monday through Friday from 8 to 4:30.
8 to 4:30.
And so our transportation, a bus or van will pick the participant up from their home or from their apartment. You can live in a house, you can live in an apartment, and they will schedule to pick the person up and bring them to the center. And they will also transport the participant, was what we call them, participants, to any specialty appointments.
Okay.
So the specialty appointments, that includes like a cardiologist, your urologist. And we also will make sure that there is a companion to meet you there, to be with you if a family member is not able to do that, to be with you when you're at your appointment.
Oh, that must be a great source of comfort for people, because I know that as my mother has aged, she's not comfortable going to the doctor by herself, and she wants somebody else to help make sure she remembers to ask the right questions and gets the right answers and so forth. So having that companion there to help make sure you get to the right place, that seems an incredible resource for folks to take advantage of. With that in mind, is there a fee involved? How do you say I need this service? How do I go about getting it?
So there are no fees. It's a Medicare and Medicaid, state and federally funded, which is wonderful. And we stay in front of the legislators to continue to ask them to fund these programs. It's really savings to everyone, taxpayers and to everyone, to fund our programs such as PACE.
Sure.
Nursing homes can be very costly. And so if you're in a PACE program, it's going to be a savings to everyone. And so we advocate for these programs and for more people to recommend their seniors to our program, because this way we are keeping the person healthy and happy and not going to the ER. Sometimes seniors will go to the emergency room because they're lonely. And then they're not really getting the services they need because they're not being addressed.
Right. That's not what the ER is for.
That's not what the ER is for.
No.
And so that's why they're
Sure.
going. And so when seniors enter our program, we have seen the ER visits go down because we have technology now that with the avatar, and there's a person that will, like a dog or a cat, that will read to the senior or will sing to them, remind them to take their medication. Medication is key to optimum health as well for that health. And so the avatar will remind them, and we have machines that will remind them to take their medication. We have a pharmacist on staff which is part of a team. Each person has a team of people that takes care of them. And every single day, Monday through Friday, the teams meet. We know everything that is happening to each and every one of the people in our program. So any change that needs to be made, we can do that day.
So does this program then kind of eliminate the need for me to have a primary care physician? The PACE facility would, and the doctors there would be my primary care?
Yes, exactly.
And is there a financial threshold that people must meet to take advantage of this? Or, I mean, you say Medicaid and Medicare, so what's the eligibility requirements to participate besides age?
So Medicaid, in the community, sometimes people don't qualify for Medicaid because their income level is too high.
Mm-hmm.
The income level is higher for PACE participants so that more people will qualify for the program. So you can have an income level as high as $2,901, which really gives you a big range for more people to qualify for Medicaid.
Mm-hmm.
And not only that, they just started a new program in March where there was a time you couldn't have assets over $2,000. Well, keep in mind, right, exactly. Keep in mind, if you can own a home, you can own a car, and you would want to have as much savings as you can because a water heater is $1,000.
Oh yeah.
So they raised that to $9,600 and I think it's $61. So which means that more people can qualify to be in the program, and they don't have to spend down or spend their money to which was wonderful that they did that. And this past March is when that happened, and so we had more people that signed up because that went into place.
Nice.
So, which is really, really wonderful. But we also have an option. You can have Medicare and you can private pay. And we do have people in our program that have Medicare and they private pay, which is really, really great. So, this program is for everyone at all levels. Just give us a call and we can go over what that looks like.
Fantastic. So I'm excited about this program. I'd like to get involved. I'd like to support it. What are the ways in which people can support the work you're doing?
So we have a program for if you want to volunteer, and you can purchase items for us on the Amazon. We have an Amazon wish list,
nice,
which is really great because sometimes people want to know where their money is going. But you can also do a donation, which is tax deductible, and you can also visit careresources.org/donate. And so communities can get involved. You can call us come in for a tour. Seeing this place in action, I can tell you.
Where are you located?
We're located in Grand Rapids. We're at 4150 Kalamazoo Avenue. In Lowell, we're at 11730 Fulton Street East on the main street in Lowell.
Okay.
We just opened that building in Lowell in January, and so which is really great. These are two wonderful communities. So we are in Kent County. We cover all of Kent County and some surrounding communities.
Wonderful.
Mm-hmm.
I just really want to say thank you so much for coming in, speaking with me today about the great work that PACE does. I mean, what a fantastic resource we have in our community, and hopefully we demystified it and made it a little bit less of a well-kept secret.
A well-kept secret. And so let me give you the number that you can call if you are interested in coming in for a tour and seeing what we're all about is 800-610-6299. And our goal is not to be the best kept secret. We would like to service as many seniors as possible to give them the opportunity to stay in their homes and stay in their communities.
Thank you so much, Veronica Horsley-Pettigrew, Community Outreach and Marketing Supervisor with Care Resources PACE. Thanks for coming and joining us this afternoon. You've been listening to WYCE's Community Close-Up, our weekly public affairs program produced in partnership with the Rapidian, a hyper-local news service of the Grand Rapids Community Media Center. This is WYCE's Janet Zahn. Thank you for joining us.
Thank you.